Welcome back to the Weiner Special Treat, because with us today we have Dr. Phil Ross, who is the newest addition to the Weiner Wellness Center and has been one of the amazing additions as I've heard. I want to come see you, Dr. Phil, but I'm so excited you're here. Thank you for being here. You're going to talk to us about chiropractic and sports rehab and all the things that go along with that. So I'm just going to step back and let you introduce yourself. And if you need me, I'll be right down here in the corner.
All righty. Well, thank you. Yeah, nice to meet everybody. Dr. Phil Ross. I think this is my 9th week over at the Weiner Wellness Center. Loving every minute of it so far. Trying to bring some new technology, new modalities over here. So a little bit of background about myself. So I'm from the South Hills. I went to Peters Township, and then I went to undergrad at La Roche University. Studied health science. And then I went to grad school out at Logan College of Chiropractic in St. Louis, Missouri. So I'm a chiropractor, but I also went for a master's in sports rehabilitation. So
I hear you again.
You hear me?
You good?
You're good.
Still
We're
good?
good?
Yep, go ahead.
All right. Sorry about that, guys.
Just because you're new, Dr. Phil, we do that to all new people. So go ahead.
Just quick prank. All right.
Just quick prank.
Yeah. So I went and I went to grad school over at Logan University. So chiropractor, but also went for a master's in sports rehabilitation. So trying to bring some new modalities and some newer technology to the clinic just to help everybody heal. Chiropractor over here, and I've been practicing for over 2 years. And at my prior clinic, it was more of a integrative health clinic. So we dealt a lot with a lot of patients, predominantly athletes. So I worked with anywhere from as young as 3 years old, and my oldest patient was actually 100 years old. And I went golfing with him 2 months ago, which was really, really cool. What we have serviced here, we just actually got 2 new pieces of technology that are really, really nice. So they're called Normatec compression boots. So basically what the Normatec compression boots do is they pump everything out of your legs. So a lot of people who are avid runners, they come in and they'll use them. And what it does is it's like a vasodilator. So what it does is it pumps all the bad metabolites and lactic acid out of your leg, and it gets recycled, and you feel like you have a fresh set of legs after. And they're actually really, really nice. And the other thing that's big news, and I was pushing Jamie to get it, and he finally got it for me, was we got a class 4 therapeutic laser. So I use that on almost every single condition. What that does is, without going too scientific into it, the umbrella, what it does is it's a reduction of pain, inflammation, it increases your range of motion, and it facilitates the body to heal itself naturally. So a good analogy, very simple, is when you're looking at a plant and the plant gets sunlight just for energy, basically what we're doing is we're donating photon energy to the cell so you could heal quicker. So how it works is you have to look how light reacts with the human body. So it's all photon energy, which basically is donated to the mitochondria, and then 3 things happen. So first, ATP, which is basically all your cellular energy. It provides more ATP to the cells, so you could produce more healthy cells, and it basically just decreases a ton of inflammation and increases mobility. And the big thing that it helps with too is it helps with nitric oxide and O2 perfusion across the cell membrane. So what I've had the most success in the prior with the laser therapy is peripheral neuropathies. So any kind of like peripheral nerve entrapment, and also for diabetic neuropathies too. So I had a laundry list of patients where they came in, doc, my feet are burning, tingling, it doesn't feel right. And if we actually laser their feet, it will allow for more nitric oxide down there, and it could actually kill the pain, numbness, tingling. Some people call it shock waves in their feet, and they have a lot better sensation, and they feel like it's giving them their quality of life back. So that's a really, really nice tool. And the only contraindications for the class 4 laser therapy is if you have a pacemaker, you can't do it directly over the pacemaker. If you're pregnant, don't want to take blood away from the fetus. If you have a spinal cord stimulator, direct eye exposure, not over reproductive organs, not over your thyroid tissue, or over cancerous tumors, because again, you're facilitating energy to the body. So if you laser a cancerous tumor, you don't want that thing growing. So those are the only contraindications. And I actually learned about this when I was at Logan. So we had a laser therapy, and we had a couple classes on it. And at first I was thinking, man, this is just a red light. It's just warm. It's not really doing anything. My first experience with it was when we actually had a quadriplegic at Mid Rivers Outpatient Center, and he had an open wound on his heel, and he went to every ologist you could think of, and no one could figure out how to close this wound on his heel because he had a poor blood supply to it, and he was actually going for a scheduled leg amputation, and he last ditch effort said, well, I'm going to try a chiropractor, and he came to our clinic, and we had a laser at the time. And we lasered his heel for, it was twice a week for 10 weeks. And it literally closed the wound on his heel, and he did not have to get his leg amputated. So once you see that firsthand experience, that sold it for me. And I almost use it on every single patient just because it increases your healing capacity. It's so beneficial for the body. So that is a really, really nice modality to use in conjunction with the chiropractic care and the sports rehab. So yeah, that's one of the other ones. And so what I also do is bringing new to the clinic is if anybody's heard of cupping therapy. So we do cupping therapy here, which basically you could use it for a wide variety of conditions. I like to use it just if you have any kind of peripheral nerve entrapment. So for example, if you have like a numb spot in your back, or if you're just chronically tight, what the cup does is it actually pulls your skin and your fascia off of the muscle so everything underneath can breathe. So it will actually bring more blood flow to the area. And a lot of people, when they have the cups off, they say everything just really, really loosens up. So we do the cupping therapy. We also do the Graston therapy. So that's also called instrument-assisted soft tissue mobilization. And the reason why I like to do all these with conjunction of chiropractic is I love chiropractic. You could help a lot of people with it. But there are some instances where people are so tight and some certain tissues so tight that it's pulling on the osseous structure. So all these soft tissue structures are attached to an osseous structure like a bone. So if you adjust certain segments of the spine and you have tight soft tissue pulling on it, it's just going to pull back out of whack. So I like to do a lot of the soft tissue therapy in conjunction with chiropractic therapy. So the instrument-assisted soft tissue mobilization, it's basically just using different tools to try and release fascia, which the fascia is basically like a pantyhose that wraps around your muscle. And it just allows everything to breathe, and it actually allows the fascia to organize in a more linear fashion, so you're not as tight. So a lot of people with chronic trigger points or coming in, doc, my upper traps are crazy tight. Can we loosen these up? Yeah, absolutely. So we'll get some Graston tool on them, do some cupping therapy. And I like the laser before because I feel like that works a little bit more beneficial as well. So any questions for me so far, Tracy?
No, it looks all good.
Okay.
They were asking about the video. I have a question. Can
Okay.
I ask questions?
Absolutely. Yes, you can.
Okay. I want to go back to the cupping. So when I experience cupping, is there, I guess this goes with qualification of people that do it. There was two things that I experienced. One, I felt like it locked up my trap. And the second thing was the bruising lasted a really long time. Can you address this thing? Because sometimes I think people see it and they're like, that's not normal. Yeah. So the bruising I understood, but do you think people can overdo it with cupping?
Yeah, absolutely. So it depends too. So if you go to like a lot of acupuncturists do cupping as well. So if you go to a practitioner who does that, they usually kind of use like the flame with the heat and put it on. We use vacuum. So usually you definitely can't overdo it with cupping and you get a lot of soreness from it. So when I cup, it's usually definitely no more than 10 minutes they're on, because you're right. If you leave them on too long and you bruise, you're going to have a detrimental effect from it. Yeah. So yeah. And then what we also did was one of my more recent patients, he had a distal bicep tendon tear. And so we actually used the cupping to release some of the adhesions from his surgery over his scar. So what we would do was you would actually, it's called like transdermal cupping. So you actually put it on and you can move it around. And that actually helped to loosen up some of the adhesions built up from the scar tissue after his distal bicep tendon repair. And he has his full range of motion back. Yeah. So that's yeah. So you could use it for a wide variety of things.
All right. Well, thank you.
Yeah.
Those were my questions.
Not a problem at all. Yep. So, yeah, so I use that. And then the Graston too works really well with the plantar fasciitis. So at my prior clinic, we dealt with a predominantly more athletic population. So a lot of people with the plantar fasciitis, laser 100% works for that. And then the Graston tool and just kind of getting into the fascia to release it. So we do stuff like that. And then also with my background, not only do you get treatment here, we actually go over corrective exercises. So I like to mainly treat patients, educate them, and then we are actually working on building a rehab room currently where we could actually take them in and show them different stretches you could do, different exercises you could do, how to properly use a foam roller, and just a ton of different things going on. So any other questions about those?
No, I think the overcorrectiveness is a big one. A lot of people on the last lecture, when I was talking about SPMs, because they modulate inflammation, they were asking about like overdoing it, ligament pain, tendon pain. And I'm usually like, that could be a structural misalignment, that could be improper, form. but it also can just be overuse. So maybe just addressing that a little bit and why people need to look out for that.
Yeah, absolutely. So let's take we'll do an example of like an Achilles tendonitis. So a lot of that's pretty common. When people come in with Achilles tendonitis, you want to poke the bear when you treat it, but you don't want to make it too angry. So a lot of people are like, Doc, my Achilles is killing me. I just stopped running uphill. I'm just running flat now. I'm going to just go after it. You almost want to give it a little bit of a break. And so for an Achilles tendonitis, what we'll do is we'll do the soft tissue to the soleus and the gastroc just to release everything. And then we'll take them in the other room and we'll show them different kind of trigger point things you could do at home with a lacrosse ball, with a massage gun, foam roller. And then we'll give them some eccentric loading exercises to kind of restructure the tendon, and so it's not so tight. So that's a big thing. A lot of people they just keep going and going and don't give themselves a chance to heal. There's a time to keep going, but you also need to take a little bit of time off and just kind of treat yourself at home. So what I like to tell patients is I can only do so much in our time here. I hate giving people homework, but sometimes you got to do the homework if you want to feel better.
You got to do the homework. Yeah,
got to do the homework. Yeah.
There's a question that says, myasthenia gravis. Have you ever treated anyone with
myasthenia gravis? I have not personally, but with that condition, we could definitely do some soft tissue stuff that could help decrease the symptoms from it. So currently treating a person with MS, and not treating MS at all, but treating the symptoms just so they could have a better quality of life. So there's certain things we could do, like trigger point releases. So when I was in school, I went for, it's called active release technique, ART. I went for spine and lower extremity, and basically it's like pinning and stretching muscles. So we're trying to decrease the tension in the muscle so you have more range of motion and to elongate the muscle. So there's different kinds of therapies that we can do that could increase the extensibility of the tissue and surrounding musculature, so you're not so tight. So actually, one of my patients I had this morning, she was dealing with carpal tunnel syndrome. So she went and got a nerve conduction study, and it came back that she had bilateral mild carpal tunnel. I think that you don't need to go under the knife for that necessarily. If it's mild, why not try and treat it holistic before you go under the knife? So what we did was we actually got the laser on her nerve, because what the laser would do is decreases the inflammation. So it will basically turn off the calcium ion channel on the nerve. And then we did some soft tissue. So for example, we worked on her forearm flexors to try and create more room for that median and ulnar nerve to breathe, so she doesn't feel the numbness, tingling, and the weakness in her hands.
That's awesome.
Okay. Yeah. And I see another question up there.
How would you address forward head posture with severe SCM and trap tightness and inflammation? I have seen 5 chiros with little progress. Okay. It looks like Heather's coming in.
So that's a good question. So if you have anterior head carriage and you're kind of sitting like this and the shoulders rounded and everything, how I would treat that first, we would probably get some laser therapy to heat the muscle up so it's a little bit more mendable. And then what we would do is I do a lot of ART on the traps. So it's basically pinning and stretching the muscle so we could allow the muscle to elongate. And then we could go over different corrective exercises like wall angels, different kind of various pec stretches. And as well with like chronic SCM tightness, a lot of people, desk jockeys sitting at the computer 40 hours a week, and naturally your head's going to kind of go into an anterior head carriage. So what I like to do is strip out the scalene muscles, the front muscles on your neck here, SCMs as well with like active release technique. And then also do a little bit of the Grasson tool as well, just to kind of release the muscle. And then we could go over corrective postural exercises. So if you are sitting for your occupation, or even if you're not sitting for your occupation, different stretches you could do a couple times during the day to try and to get your shoulders to naturally roll back, and then your head will want to come back as well. So yeah, it's kind of funny when you have a patient going and they're like, Doc, I've seen 7-8 different chiropractors. I'm not getting any relief. And I always ask them, well, what are they doing for you? And they say, well, I lay on the table, they adjust my neck, and I walk out. That works for certain patient conditions for sure. But if you have something severe, and if that's a chronic anterior head carriage, we got to do some muscle work. So most of the appointment would be doing most of the muscle work therapy, and then we would adjust you at the end just to kind of solidify everything too. So that is something I feel completely competent treating. So yeah, if you want to give it a shot, definitely come on in and we could treat that.
Yeah, absolutely. And wall angels. Yeah. People think those are easy.
Yeah, they're very, very easy. But it's they're just hard. Trying to get your it's just trying to get your body in a different motor pattern. So because if you do the same thing day in, day out, you create a faulty motor pattern, bad biomechanical movement. So it's nice to give people postural cues and exercises, and it's not a cookie cutter response. One thing might work for one patient, and sometimes that doesn't work, and then you have to kind of dive in and give them different exercises. But I feel confident that we could always find a certain postural cue for someone, and they'll be like, oh, that resonates in my brain. I could do that. So those wall angels help.
They do, but I used to, when I did personal training, one of the things I would do was, core training and structural realignment, because, if you have poor posture and then you apply weight to that, you're going to end up with an injury. And that's the thing, is chiropractic is not just when you're hurt. It should be a maintenance, especially for people that work out, athletes, people that have desk jobs, like you're sitting all the time. It should be part of your regimen of healthcare. Don't make it sick care. That's what I always tell people. Like, chiropractic is healthcare, not just sick care.
100% agree.
Yeah.
Yes.
So when people come see you, what does your treatment plan look like? What do they experience first? What, and how many sessions do you think? Because, people are always saying, oh, my chiropractor tried to sell me 20 sessions. And while I think I could just help with money, that's not always the program that they need. So give us a little insight on what yours looks like.
Completely agree. So it's all individualized. So depending on the pathology and depending on the individual, their lifestyle, what they put in their body, what medication supplements they take. So basically, new patient, full exam, head to toe. We're talking, reflexes, myotones, overtones, everything, just to rule out anything more serious. But I usually do. It depends on the condition, but I would say generalized. 1 or 2 treatments a week for maybe 2 or 3 weeks. I'm the same way. I hate when you would go to a chiropractor and they'd say, well, we need to lock you in for 50 treatments this, for this condition, or you need to come at least 20 times. If you're a healthy individual and you're active and you do your homework at home, it might not take 20 visits. It might take, 5 or 6 visits. Sometimes people come in and, for example, chronic migraine headaches, you have this called your suboccipital muscles. Sometimes they could grab on a nerve that could refer a headache. If we work those muscles out, adjust their cervical spine, and they feel good, and they do the muscle releases at home, sometimes you only see those people 2 or 3 times a year when they have a really, really bad flared up migraine. I'm not one of those guys that say you need to come once a week for the rest of your life or your legs are going to fall off by any means. I like to treat based on the individual, what they need, and how they progress. And I know when to swallow my pride. So for example, very common for a chiropractic visit is someone comes in, hey doc, I got neck pain. It's running down my arms. I will do my best to treat you. In most cases, we get a ton of symptomatic relief. But if I treat you 3 or 4 times and you say, hey doc, I'm at a standstill, I'm not feeling too well, it's not getting too much better, then I know when to swallow my pride and say, okay, let's order you an MRI. Let's see if you have a disc herniation, disc bulge. Let's see the underlying pathology. And if they have a severe disc bulge or disc herniation, working for 2 years, have a lot of connections. So we could either send you to a pain management doc. We could send you to, if need be, an orthopedic surgeon. So I like the holistic approach for I like the holistic approach for everybody, but there are times where you need to dive into some allopathic medicine. So for example, with that same example with the neck pain running down your arms, sometimes if you have a significantly flared up disc, no matter what I do in the clinic, you won't get too much relief. So what I like to do is, say, hey, go see your PCP. Sometimes you need a steroid, like a Medrol dose pack or a prednisone, to calm your systemic inflammation initially, just like a quick 4 or 5 day, and then we could treat you better, and just more effectively, more efficiently, and then you get on the X-Flame just for the anti-inflammatory. So I basically look at the individual, what they need, depends on the pathology, and then kind of go from there.
Good stuff. Sounds awesome.
Yeah.
All right, you can continue. I didn't mean to interrupt your lecture.
Oh, it's all right. I see another question. No, you're fine. Don't worry about it. Any questions, please just throw them at me. So,
okay.
Seeing another question here.
That was Jamie, I think.
Treatment,
That was Jamie.
Full service. Jamie, he very, very active lifestyle in the gym rat, and he is just crazy chronically tight all the time. So most of the time, I'm not the kind of guy you come in, you get a 10, 15-minute adjustment. Hey, Mrs. Smith, we'll see you in 2 weeks. And that's not me. I want to try and get you as good as you can so you could have a better quality of life and you see me as less as possible. I always tell patients I love seeing you in the clinic, but I would rather see you at Giant Eagle when you're feeling good so you don't have to come in. But for example, the different explain about the treatment. So yeah, basically come in, assess how you're feeling. Have you had any recent traumas, injuries, illnesses? And basically just get a feel of how you responded from the prior treatment. So did your symptoms flare up? When you were cutting the grass, when you were weed whacking, did this flare up on you? Did you ice at home? Did you take your X-Flame? Did you do anything at home, Epsom salt bath, and see how they responded after the first treatment? And then if there's no red flags and they responded well, we kind of just stick to the program. So for example, Jamie, he at first it was his calves, and then a couple other things were hurting him. So basically just adjust what he's feeling at the time being. And we got his calves calmed down because we got those Normatec boots, put him on those a couple times. That helped the symptoms. But yeah, so like I'd like to do a ton of soft tissue with them just to kind of calm everything down before we treat them. Because if you have someone who's very, very tight and you just go to adjust them, sometimes when you go to a chiropractor and they say, man, that was painful, that didn't feel good, that could be part of the reason. Because if you don't do the soft tissue work before and relax the muscles, it's called like muscle guarding. You're just so tight and tense. If you go to adjust them, they're not going to move, and you might hurting them. You might end up hurting them because they have a tight muscle, and then that muscle goes into a spasm. So I like to do a lot of soft tissue. The other thing we use over here, very popular now with everyday people, is the massage gun. Phil, I know you like it. It's good. Real good. It basically just works on the neurological system. So if you have a tight muscle, so the massage gun, the main ones out there, Hypervolt Theragun, what happens is it delivers a rapid impulse. So it's like over 2,000 beats per minute. And so when you rapidly tap a muscle, it stimulates, it's called the Golgi tendon organ. So in every single muscle, you have a Golgi tendon organ and a muscle spindle. When you rapidly tap it, it sends a afferent stimulus to the brain, and the brain sends an efferent stimulus back down to the muscle and tells it to relax and elongate. So a lot of people, they're like, Doc, that massage gun, I feel a lot looser after that. It does that just because it works on your nervous system. Chiropractic that's hand in hand. You're just working on the nervous system to just kind of calm everything down and adjust certain segments. So what also is nice about chiropractic is, when you adjust certain segments of the spine, it instills a parasympathetic response. So your two nervous systems, sympathetic, parasympathetic nervous system. Sympathetic is basically you see a bear in the woods. That's how your body responds. Parasympathetics is your rest and digest. So a lot of people everyday stress of life, pandemic last year, money's tight. When they come in and get adjusted, come in and get it treated and adjusted, it instills a parasympathetic nervous response. So you just feel like just more relaxed, and you just feel better in your own skin. So that's why I like when people come in for maintenance cares, because even though Tracy, you spoke on it, even though you are feeling good, it is nice to keep that going. Not just come in, oh shoot, I pulled my lawnmower, my back went out again. That takes a lot more treatments, and that's harder to fix as opposed to I feel pretty good. I'm still going to go in and see doc, maybe once a month, once every other month, just to make sure everything's in line and get the soft tissue work. And so another question about the laser, what benefits does it provide? So it does just a lot of good. Just to recap on it, what the laser does is the main thing is a reduction of pain. So that's the biggest thing. A lot of people coming in with acute pain, it basically just kills your pain. That's the big thing. So I hate chasing pain. I like looking for the source, but if you got someone coming in saying, "Doc, I was at soccer practice and I went to take off and I tweaked my hamstring," if you get the laser therapy on it, not only will bring increased blood flow and decrease the inflammation in the area, but it will also reduce the pain. And by doing that with the increased blood flow, it will actually allow you just get greater range of motion as well. And I had a question earlier from a previous patient yesterday. Can this help with arthritis? It definitely can. It literally helps with almost any single condition you could think about, just because this laser therapy, it's a class 4. It has a ton of different wavelengths. So we got the Rolls Royce. So we got the Aspen Pinnacle. It is a 980 nanometer laser, and it's actually the most powerful one in the world right now because it's a 60 watt. So certain dentists actually use lasers as well. But they are usually a K laser and they're like a 15 watt. So we went with the Rolls Royce because I didn't want it to be a placebo. So you could say, hey, let's do the laser therapy. But unless you're working with a 60 watt laser, you're not really hitting anything, because at 60 watts, you could actually penetrate it's like 2.42 inches into the skin. So it has deep penetration. It's a deep heat. So it literally will just honestly help almost every single condition. Another one that I haven't got to use it on, which I'm waiting to, I want to use it on a patient. Actually just was listening to another doc talk, shingles. So people have a shingle flare up. This laser is actually supposed to help immensely with a shingle flare up. So I would like to use that on one of those patients. And I also used it at my previous clinic on a lot of patients with a diabetic neuropathy. Like I spoke earlier, it does help if your A1C is under like 8. If your A1C is through the roof, we could laser you, but it's not going to work as great. You need a little bit lower of an A1C. That laser therapy works just a ton of people. The other service that we're bringing in,
I know you're helping Monica a lot.
Yeah,
she's been struggling to find help, and the laser's really helping.
Yeah, that's right. Thank you, Phil. So so Monica, coworker of mine, she's been having some crazy like left scap pain, like her left shoulder blade. After just assessing her and diagnosing her and everything, we another thing we got here is an inversion table. So inversion table is great for a lot of people. I use it at least once a week. So if you think about it, if you're sleeping 6 hours a day, 18 hours a day, you got gravity compression down on your spine and just crushing your discs. Some people in the seated position, you actually have the most disc pressure in the seated position, second most laying on your belly. So a lot of people working your typical 9-to-5 job in the seated position all the time. Basically what it does is it compresses the disc. So when you're compressing the disc, sometimes this might be a little too detailed, but we'll just call it the jelly inside the jelly donut. Sometimes your nucleus propulsus, the jelly, squeaks out of your annular fibrosis, your donut, and you have 8 main inflammatory proteins. And so when the 8 main inflammatory proteins leak onto the nerve, it causes it to depolarize. So you feel a sensation. So for example, in the cervical spine and your neck running down your arm, sometimes you just feel it in your bicep, sometimes just in your tricep. And a lot of times people don't recognize it actually runs down into your shoulder blade. So with that being said, Monica was, she got treated. I think she got a couple deep tissue massages, a little bit of symptomatic relief for, a day or two, but nothing long lasting. So we actually got her in and I started working on her neck using the McKenzie protocol. So can't say I'm certified in McKenzie technique, but took a class in school from it and use it almost every single day if you have neck pain or low back pain run into an extremity. So basically we got her on the McKenzie protocol. and put her on the inversion table to increase the joint space in between the discs. So when you have a compression in a disc like that, inversion table is fantastic just because it decompresses your whole spine. So a lot of people coming in, doc, I got low back pain. It's running down my legs. It's killing me. It's waking me up. I can't sleep. Once we do some of the soft tissue and laser over the disc and then actually put them on the inversion table to decrease the pressure in their spine, they get immense relief. And then we send them home with the McKenzie protocol, which is basically finding a correct movement pattern to create more room for that nerve to breathe. So when you have a radiculopathy, so a swollen nerve root or a pinched nerve running down your leg, it usually grows 3 times the size of its normal size. So think of that nerve is not clearing through the frame and the hole it's supposed to. So when you move a certain way, if you're sitting in a certain position, it's just constantly depolarizing. It's getting irritated. So when we put you in a certain position and give you corrective exercises to go into that position, it will decrease your pain because you're creating more space for the nerve to breathe. So that's what I like to do, and that really, really did help Monica, and she got a ton of relief. I've been lasering her basically every single day for about, I want to say 6 days, and she feels incredible. So that's really, really working. And I saw another question: can laser be used on dogs? Absolutely. I like to use laser with dogs in conjunction with most of the supplements that we actually sell here. So the MSM, chondroitin, and glucosamine. So basically the joint lubricant. I've lasered maybe 5 or 6 dogs. You could do it on their feet. Hips are very, very common too. So I have my mom and dad, we have a half German Shepherd, half Husky, Sasha, and her hips have been going bad on her. She's an old girl, but she still plays like a puppy, likes to walk at least 2 miles a day. And sometimes her hip will kind of get jammed up on her. So laser therapy worked great for her. We actually got her on some CBD supplements as well, because CBD, naturally anti-inflammatory, neuroprotectant. And then we actually got some of the supplements from here. So we got her on the chondroitin, MSM, and glucosamine, and that's helping her symptoms great. So yeah, you could use it on dogs as well.
It's like the universal laser.
It helps so many people. That's why I felt like we almost needed it here, because I would feel terrible, because you can improve people's quality of life greatly with it, and it's just a great, useful tool.
Awesome.
Yeah.
So we've heard about the cupping, we've heard about the laser, and so how many sessions do you feel for cupping or laser therapy is beneficial?
Great question. So in the acute response, so if you're dealing with an acute exacerbation of a pathology or pain, laser treatment, the gold standard is usually around 6. So 6 treatments is where you're going to get the most therapeutic benefit. So usually if you're in acute pain, so, hey, doc, I jammed my shoulder, I can't do a military press, I feel it bleeding down into my arm here, like an impingement syndrome. What I like to do is usually like 2 treatments per week for 3 weeks. And if you are significantly hindered by your pathology or injury, you could do 3 treatments a week. Some people recommend 5 treatments a week, like once a day for a whole week during the work week. I think that's a little overkill in my opinion, but I like, you could do as much as 3 a week. So if you have an acute exacerbation of an injury, usually 2 times a week we'll do it. And so when we laser, treatment time varies due to what pathology you're treating. So you're going to get a different wavelength, a different kind of heat produced. The only byproduct from the laser is heat, which a lot of people think that's a good thing. That feels pretty good. So there's different settings for it, just because it works on different wavelengths for different tissues you're trying to target. So if you're trying to hit a nerve, different wavelength. If you're trying to go just for a muscle or a myofibril, different wavelength. So there's differences. And a lot of people, they would just come in once your pain's under control. It's not a bad idea to maybe pop in, maybe once a month, just even for a laser treatment. So if it's a nerve problem, just to keep depolar, or to kind of seal that nerve up, so to speak, so it's not tripping, and so you don't go back to square one. Because the worst feeling is when you get someone feeling great and you say, okay, well, you're feeling pretty good. Well, you know your body call when you want to come in and when you need it. You cut them loose, and then they come in and they're worse off from the first time. That's the worst. So, yeah, it's not a bad idea to come in just for maintenance care.
Okay.
Yeah.
And what about kids? Do you see kids?
I do, yeah. So my youngest kid I've seen was 3 years old. I have no problem with working on kids. Kids are actually fun too, because when you're young, you have so many stem cells per cell in your body. You heal crazy fast. So I like working with kids. Prior clinic, I worked with a ton of athletes, most of them being high school athletes, collegiate, and then we actually had a couple professional athletes as well. So they're fun to work with. Love working with kids. I truly just like trying to improve people's quality of life. So anything that I could do to improve your quality of life. So if you like babysitting your grandkids and you can't pick your granddaughter off the floor because of your back pain, that is my goal to basically enable you to. I don't want you to feel scared trying to go, pick your grandchild off the floor. We're going to get you comfortable doing that pain-free. So I like working with everybody. The last thing that we're bringing to the clinic too, I played soccer my whole life. I played high school through college. As soon as I graduated college, I heard horror stories about my friends tearing ACLs, MCLs, and I had 2 prior shoulder surgeries myself, actually, which the laser really, really helped. Yeah, so after that, I was like, I can't play soccer anymore. I can't afford an injury, so I started picking up golf. Love golf now. So I actually went 2 years ago and it's called TPI certified. So it's the Titleist Performance Institute. So it's a golf certification. So it basically takes you through the 16 main biomechanical movements in a golf swing, and it assesses them, checks your range of motion, and seeing what muscles are working efficiently. So what's strong, what's weak, what's tight, and basically take them through like a golf protocol. And then I love working with the golfers as well. So it's my goal, if someone's in pain, is to get them out of pain so they could golf a full round, 18 holes, asymptomatic. And then I like giving a lot of different corrective exercises and stretches before you go play around. Because, I love golfing and love having people come in and saying, Doc, I can't golf. My back's killing me when I'm golfing. Or, when I fall through, my ankle's killing me. Can we do something about it? And a lot of people think just back with golf, not necessarily at all. So I treated a guy with he had like an Achilles tendinopathy, golfer. Got him back pain-free. He's golfing, I want to say 36 holes at least 36 holes a week. And, that's a lot. And he's in his 60s and he hasn't had problems with his Achilles since, just through the golf protocol and the different corrective exercises and just the homework with the stretching as well. So love working with golfers. Golf screen's very, very fun. A lot of people enjoy that. And so, that's another cool thing as well we're bringing over here.
You just treated somebody and you were working on your swing?
Yeah, absolutely. Yeah. So first thing is to get them out of pain. Once they're out of pain, then we go on different things to, try and add 15, 20 yards on your drive and just different ways to swing. So, and you start with the health history. So a good example. So I learned from Dave Phillips. He's actually, people don't know golf, might not know this name, but John Rahm, fantastic. I think he's actually currently number 1 in the world right now, but he was born with a club foot. So you figure out different like biomechanical movement patterns to work around that injury. So it's pretty cool stuff. And a lot of people really, really like it.
Yeah. So there's a question about persistent Achilles tendonitis in a 17-year-old ballerina.
Mm-hmm. Okay. Had her whole career. Had a good physical therapist, temporarily relief, any cure, just continual maintenance? Great question. So I would say if it's been persistent and she had Achilles tendonitis but it's been for, multiple years, now it's probably at the tendinopathy stage. So itis, inflammation, acute tendinopathy going on for a long time. PT is fantastic for Achilles tendonitis or tendinopathy. So hopefully the physical therapist is giving her eccentric loading of the tendon, because that's the best way to cure and help rehab a tendinopathy or a tendonitis, especially for the Achilles. You've been told maintenance during her dance career. So I would say there is a cure. So I've had a ton of success, especially basketball players and runners coming in way flared up Achilles tendonitis. So with that being said, you can't just treat the Achilles tendon. You got to treat the muscles that lead up to the Achilles tendon. So you have your gastrocnemius and then you have your soleus. So gastroc is mainly for more powerful movements like jumping, sprinting. Soleus is mainly for walking and balance. So those two muscles basically run in and create your Achilles tendon. So with that being said, soft tissue is absolutely massive for it. So you also got to check the mobility of the ankle joint, the mortise joint. If you have decreased motion in your ankle, that could add more tension on the Achilles. But I think I've had a ton of good stories about someone coming in with the Achilles tendonitis, and just from the laser therapy, to be honest with you, but the soft tissue as well. So you got to address the soleus. So for that's your Graston, that's cupping, and then the ART, and then we also do it's called fascial stretch therapy. So it's basically we were talking about the fascia is kind of like a pantyhose. So it's basically pantyhose that surrounds a muscle. If you have tight fascia somewhere in the lower extremity, if we strip out that fascia to kind of release that pantyhose, so basically the muscle could breathe better. And then I would have her dive into just eccentric loading of the tendon. So we got a couple different kind of balance balls, foam pads over here. So we would almost see what provokes her symptom and kind of digress from there, and then kind of work back up to it. So a lot of people, I do kind of high-end rehab with that. So we'll basically put her on the affected leg, have her balanced in a certain position, and then basically just kind of move her off of balance, or even throw her balls where she has to go through different motion patterns just to kind of rehab the Achilles. So I feel 100% confident for Achilles tendonitis. Can definitely treat that. I don't think that's anything that would be like lifelong. I think you could definitely find symptomatic relief, and and then it comes down to homework. So basically, maybe getting an Epsom salt bath to release the muscle, some magnesium just to release the muscle so it's a little bit so it's not as tight, and then just going through rehab protocols as well. And then I've had multiple runners where I treated about 6-8 visits, felt great, never seen them again because it totally went away. And then you get a call or a text down the road, hey doc, running the half marathon, no pain, feel great.
Those are the best when they fire you.
Yeah.
For good reason.
Yes, for good reasons. Yeah.
Yeah. So that's awesome. I mean, we have about 10 minutes left for any more questions that anyone puts in the chat box. What are some of the more common injuries that you see in men, women, and athletes? Like what are your, these are the top ones I always see. And why do you think that is? Is there anything we can do to be healthier?
Good question. I would say most common injuries that come in. So when you think chiropractor, you think neck or low back. So I do see the technical term, medical term diagnosis is like radiculopathy. So cervical radiculopathy, lumbosacral radiculopathy. So like pain in the low back or neck running down to an extremity into your hands or your legs, or just your typical neck or low back pain. In my opinion, just from working with patients, it seems like it's more, I would say, just not an active lifestyle. So, if you got people with sedentary lifestyle, that's when you get your people, oh, my neck's killing me, my low back's killing me when I do certain things. So I would say most of those. I do have for the athletes, a lot of just muscle strains, sometimes a sprain of a ligament, roll your ankle, just a grade 1 ATFL sprain. That's easy. But for the athletes, you feel bad when you have a pretty significant muscle strain, but it is nice working with those because it's cool to see the progression. So I do a lot of muscle testing. So we'll check the strength of the muscle, and then once you treat them 2 or 3 times, and you treat them pretty heavy, and then they come back in, and then you said, you squatted 2 weeks ago and you couldn't even squat without any pain, and then they go down and they crank out 10 squats asymptomatic. So those are always nice too. And again, so like I like when imaging is warranted, I send for images as well. So a lot of people, weekend warriors in the wintertime, skier, you got a mom coming in. I took my daughter skiing at Seven Springs. I think I jacked my knee up. What's going on?
That never happens. I don't know what you're talking about.
So
we think we're 20. We do.
Yeah.
We think we're 20.
Yeah. So I'm not one of those docs who you come in with neck pain, I'm going to send you for an x-ray right away. If I treat you, if we go through a conservative treatment plan and we're not seeing any results, and if an x-ray is warranted, I'll send you for an x-ray. Or, if I think it could be something ligamentous or, tendon injury in the knee, we'll send you for an MRI, just because I would hate to treat you. If I have a gut feeling that there could be like a tendon tear, a muscle tear, we'll send you for an ultrasound or an MRI, just because you don't want that to go too long, and then we'll get you to the right practitioner, whether it's an ortho, a good physical therapist. And to go back for the Achilles tendonitis, unfortunately in the state of Pennsylvania, chiropractors cannot do dry needling. Physical therapists, kind of a gray area, but dry needling works very, very well for like an Achilles tendonitis, especially if you dry needle in the soleus or the gastrocnemius. That works really, really well. So, but that's pretty well went there.
Well, that's been awesome. Thank you so much for sharing everything and
Absolutely.
for being part of the Weiner Wellness Center. So you do have appointments available, so we can call the office, make an appointment with Dr. Phil. It's not too far to drive in. I'm sure you have lots of people drive to see you.
Yes. Yeah, absolutely. Yep.
Yeah. When you find a good doctor, you want to keep going. So thank you,
Yes.
Dr. Phil, for being here. And everybody, if you need to make an appointment, you can call the office, 412-922-WELL, 412-922-9355, and set up your consultation with Dr. Phil Ross so that he can get you on the right path for your health. So Thank you so much.
All right. Thank you, guys.
All right, guys, stay tuned because Wendy Small is coming up from Pure Encapsulation. She will be talking about all the new products that she's going to be sending to the Weiner Wellness Center. Stay tuned.